Senate Bill 916. Imagine this. Imagine you call 911 because someone in your family is having a medical emergency. An ambulance shows up, takes them to the hospital, and later you get the bill. Under current law, you are protected from being charged thousands of dollars extra just because that ambulance was not in your insurance network. What the bill says it does? Senate Bill 916 says it continues consumer protections against surprise ambulance bills and updates how municipal ambulance rates are set and enforced. What it actually does? This means patients keep their protection from balance billing when city-run ambulance respond to emergencies. This also means cities can adjust ambulance rates each year, but only up to a capped amount tied to inflation or 10%. At the same time, state regulators gain stronger power to punish ambulance providers that submit false data or repeatedly break billing rules. Who benefits? Patients who rely on emergency medical services, families who could otherwise face surprise medical bills, cities and counties that operate ambulance services, and health insurance plans that gain predictable rate limits. Who pays the price? Local EMS systems if their real costs rise faster than the allowed rate increases. Communities if ambulance rates quietly increase without clear public explanation. Why it matters. Emergency care is not optional. People do not shop for ambulances or compare prices in a crisis. When protections disappear, families pay the price. Senate Bill 916 keeps a safety net in place, but it also puts pressure on local governments to manage rising EMS costs carefully. If costs keep climbing faster than inflation, the strain does not disappear. It shows up in local budgets, service levels, or future rate hikes. Questions to ask your lawmakers. If EMS costs rise faster than inflation for several years, how should local governments keep services funding without cutting corners? Should there be a requirement for cities to publicly explain and justify ambulance rate increases each year? Before the protections expire again in 2027, will lawmakers commit to a full review of how the system is working for patients and communities? Bottom line, Senate Bill 916 protects Texans from surprise ambulance bills today, but its long-term success depends on transparency, oversight, and what lawmakers do before the next expiration date.